far you have come on your own, but never alone. Through the rain and through the shine, here's your moment, it's your time. You stood tall and now you see, standing in your destiny. 100 women growing strong. 100 women where you belong. You stood tall and now you see, you have reached your destiny. Woman, woman.
As people of African descent, we offer this land recognition in solidarity with the indigenous peoples of Turtle Island in the efforts and deliberate intentions toward decolonization. As people of African descent, we acknowledge the land of Turtle Island that sustains us, express deep gratitude to its indigenous peoples, and pledge to honor our dignity and divinity that ultimately connects us all. By Kay Johnson. Welcome to 100 ABC Fireside Chats. 100 Accomplished Black Canadian Women is a bold project initiated by co-authors and co-founders, the Honorable Dr. Jean Augustine, Dr. Denise O'Neill Green, and Donna Jones Simmons. Our mission is to celebrate and archive the professional accomplishments of trailblazing Black women from all across Canada. The goal is to create an ever-expanding database available for current and future generations via print media, public and private libraries, as well as our website, which is www.100abcwomen.ca. In addition to our fireside chats on topics that matter to our communities, such as education, healthcare, entertainment, creative arts, trade union, and so much more, we offer biennial book launching galas and biannual symposiums. The co-authors and co-founders would like to take this opportunity to thank each of you for attending today's fireside chat. We know that you will find these sessions educational and inspirational. So sit back, relax, and hear from our brilliant and talented honorees.
Good afternoon, everyone. Welcome to this afternoon's Fireside Chat. I am your moderator this afternoon. My name is Takia Wedderburn. I'm the founder of Natural Kids Movement, a nonprofit organization that was created to address the overrepresentation of Black children and youth in the child welfare sector. And actually this afternoon, we do have a special treat for you. We have a video that we're going to be playing. It's a special Black History Month video. So we're just going to take a look at the video and then we'll get started with today's fireside chat.
And so I said, dream big, go for your dreams. You have strengths, you have potential, go for it.
Another banger, listen up now. right now as we celebrate Black excellence all month now, all month now, all month now. Angela James, stand up now, take a bow. Garrett Morgan made gas mask a thing back in 1912. He also made the 3-light traffic system. Oh, 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 oh. Viola Desmond on the $10 banknote. Oh, 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 oh. Beyonce hit the high note. Oh, 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 oh. Jean Augustine is the go. Oh, 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 oh. Harriet Tubman was a hero in the Underground Railroad. Cardi official, always showing love to Scarborough. We wouldn't have chips if it wasn't for George Crumb and potatoes. Billie Holiday and Ella Fitzgerald, they sung with soul. Now Dr. Shirley Jackson, she was the first woman to earn a doctorate in nuclear physics. She had other inventions, including call waiting, Lincoln Alexander, first black member parliament. Where would we be without Frederick Douglass? Or Phil Downing for inventing the mailbox? Willie O'Ree took the ice. Gear shift from Richard Spikes. Music from Prince and Mike. February is the month now, to tell you what Black history is about. We've got more work to do, there is no doubt. Black is beautiful and I am so proud. Now Black history, let's go. Oh, 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 oh.
All right. So good afternoon again, everyone. What a great video to honor Black History Month. So this afternoon, today's Fireside Chat topic is going to be Black women's health, wellness, and self-care, including midwifery. So we're so excited that you could be here to join us this afternoon for this very special segment. So we're going to jump right in because I think we have a lot to cover. It's a very interesting topic that I'm curious to see how the conversation will flow this afternoon. So let's get started. So I want to start by introducing, we have two panelists, two wonderful panelists that are joining us this afternoon. We have, our first panelist is Althea Jones. So Althea is a registered midwife and founder of Ancestral Hands Midwives. She's dedicated to improving Black maternal health. She is also the president of the Association of Ontario Midwives and a mentor to the Black midwifery students, a former NCAA Division I soccer player at the University of Arizona, and Althea is now a soccer mom to her 10 and 13-year-old daughters. And then next, our next panelist this afternoon is Juliet Opoku, and I'll give Juliet an opportunity to introduce herself.
Hi, everyone. Thank you for inviting me. So my name is Juliet Opoku. I am the CEO of our health and wellness company, Living a Balanced Life, incorporated in GTA. I'm a mother of 4. I'm a psychotherapist qualifying. I've been a nurse for 20 years. I'm the vice president of the Ghanaian Canadian Association of Ontario, and I do a lot of health education through different social media platforms. I have a YouTube channel where I put a lot of content about diabetes and chronic illness management. I'm a certified diabetes educator and a certified bariatric educator, and that's what I do. So I wear multiple hats, and I'm glad to be here today to contribute in any way I can to improve Black women's health. Yes.
Wonderful. Thank you so much, Juliet. We're so happy that you're here with us this afternoon. So as I said, we're going to jump right in. So my first question is going to be for Althea. So Althea, as a midwife and founder of Ancestral Hands Midwives, you've been deeply involved in providing culturally safe care for Black birthing people. How do you see midwifery contributing to Black women's overall health and wellness beyond pregnancy and birth?
Yeah, thanks for that question. So basically, I think midwifery is a great model for Black women and people to understand how they should be treated within the healthcare system. A very big part of midwifery care is informed choice. So making sure that people have the information to be informed decision makers and to ultimately be the primary decision maker in their healthcare. I think far too often as we move through the healthcare system, we think that whatever the provider tells us is kind of it, right? Like that's all the information that we need. Whereas as with midwives, like we really encourage people to do their own research. We'll recommend resources. We'll give them all the information that we have, risks and benefits, community standard, just to make sure that they understand the full picture and then they can make that decision. Do we make recommendations? Of course, like there's times when things come up in people's care that we're going to say, we really recommend that you do this test for A, B, and C reason. But at the end of the day, it's their own decision whether or not they're going to do that. And I think that's really important for not just during the perinatal period, so when people are pregnant and having their babies, but also how they move through the healthcare system, to make sure that they maintain that they ask questions, that they have the information to make informed choices versus just being told by the doctor or I think any other healthcare practitioner that you should do this and then that's the end of the story. Like you can ask questions in healthcare, and I think that's really important for us as Black women that we advocate for ourselves. We ask questions and we make sure that we have the right information to make decisions. So I think midwifery care is a really good model of care that really exemplifies that because we always do want to empower our clients. We do want to make sure that they are the decision makers. I think midwifery is also a really good model in terms of it being holistic care. So health and wellness, it's not just about one thing, right? Everything is interconnected. So even during pregnancy, it's not just that I think clients need to just see their midwife. It's a whole team of people that can work towards making you healthy and keeping you healthy and thriving during your pregnancy and postpartum period. So it might be a midwife, naturopath, pelvic floor physiotherapist, dietitian, right? Like it can be a whole team of people that are working towards making you feel your best, be healthy, be well. And so I just really think it's important that models like midwifery care are, expanded in our healthcare system and that clients are definitely treated the same way as they continue to move to different practitioners. And so it's important to know that, you make the decisions. Nothing can be done to your body without your consent, right? I think that sometimes we forget and we think like once you're within the system, you just have to do whatever is being told to you. No, that's not at all the case. You can ask questions. You can say no. No is a full sentence, and that's okay and totally within your right. And so I just think midwives really do a very good job of incorporating all of those things into our care, and it's a great model for people to use as they move through the healthcare system.
Yeah, that is amazing. It's so interesting. I really like your response, Althea. Because I think oftentimes, especially when it comes to healthcare, we sort of see doctors and we hold them at a very high, obviously a very high standard. And we may often, think of whatever it is that they're telling us as the end and beyond, right?
Yeah.
And I think, as you mentioned in the midwifery model, is that it's an opportunity to advocate for yourself, which is really important, and an opportunity to ask questions and to maybe seek advice from someone else, another practitioner, maybe get a second, third opinion, which is really important. And you also highlighted the importance of advocacy, especially in the Black community. I think oftentimes we forget that, we can be our own advocate. We can speak up for ourselves. We can ask questions. So I really love the fact that you highlighted that. All right. So my next question is for Juliet. So Juliet, how can Black women prioritize their mental and emotional well-being while navigating systemic stressors such as workplace discrimination, racial bias in healthcare, and societal expectations?
Yeah, that's a broad, big question. So, just like with anything, just like Athea said, everything that we do, we have to be at the forefront. I'm a big advocate on being in charge of your own health. So it's not about what the doctor tells you and everything. Like you just take it as is. You do your own research, you find out information. Being from the African descent, like from Ghana, there's a lot of people that go to the healthcare system and whatever the doctors tell them, it's like, that's it. And they go by that. And a lot of people end up suffering in silence because they think they're supposed to just abide by that. But we have to advocate in a way that we are also in a people, us in the healthcare field, that we're advocating for our client and educating them about symptoms and how to kind of navigate your body, right? Like I said, everything in our body is interconnected, mental, physical, it's all connected. When the mental health goes, the physical health follows, and vice versa, right? And being somebody in the chronic illness management field, we do see that a lot. There's a lot of clients that I deal with, especially in the Black African community, where they're dealing with different levels of issues in terms of like this, the finance that could be there, the language barrier is there, the confidence in terms of navigating through the system could be very, very limited. And so people just take things as is. And we can't do that. We have to get second, third, fourth opinion if we need to, make sure that whatever medication is prescribed to us, that it actually fits what we're being treated for, that we're not just being diagnosed with anything because we're Black people, because that happens. I mean, I've been in the healthcare field for a very long time. And I know that sometimes, and even in the mental health, where if a Black person, a Black woman goes in and they're getting some kind of assessment, the diagnosis could be very different. Labels are being slapped on people. And our mind is very powerful. When these label comes on, it does something to us, right? So we have to be very mindful that even if a doctor thinks we're going through our own symptoms, we go to see the doctor, they tell us this is what's happening, connect it with how you're feeling, and then get a second and third opinion. If you're taking medication or you'll be prescribed things that you feel is not working out for you, you know what I mean? Go back to the prescribing MD and reassess. We have that right, not to just take anything because it's prescribed. It goes with everything. Being a diabetes educator, I see this a lot where clients are being prescribed all kinds of medication that is not working for them, right? And they're taking it because that's what the doctor prescribed. And sometimes they're not being followed up as other people are being followed up, right? Because, and not just diabetes, because diabetes is a chronic illness that affects every part of the body, right? And so now that you have diabetes, your heart hurt, and every organ in your body is impacted. So if you're not careful and you're just being passive in terms of, this is what my doctor said, so I'm going to be submissive and take that, and it's not working for you, you end up developing a whole bunch of complications. Now you're dealing with all levels of issues beyond just health. Then it goes into the workforce, because now you have to go to work, you have to take certain medication, there's side effects that happens. And with these things, it's not just, I took this medication, I have a headache. People can pass out from taking certain medication. There's a lot more to deal with, right? That can impact you, the mother, the women, and your family, and it just keeps going. So my message is, whatever it is that we're going through, and life happens, we have genetic predisposition that puts us at risk for a lot of conditions. Knowing that is important, but also advocating for yourself. If you're taking medication, if you're in any space where you feel you can't thrive because of health issues or other mental health issues or concerns, you need to bring it up front, right? We need to be able to advocate for ourselves. And if these things if we don't do it, and we say, because I hear it from a lot of my Black women, oh, you talk to them, Juliet, they're not even going to listen to you anyways. But if we don't say anything, then we can assume that, or everybody can assume that things are right. So we have to advocate for ourselves. We have to be in charge of our health. We have to be mindful of how we're feeling and use those symptoms. Like I call symptoms as way of your body talking to you. What's happening, connect that, seek the help that you need. Don't neglect it, because anything can happen. And connect all of this so you can live a healthy, balanced life, so you can improve your health, impact your work, impact your family, and contribute to the society, but not just take anything as out there as the final say, because that happens, especially in my African community, a lot, where people just, bow down to what the doctor, the nurses, or whatever say, and then that's the end of it. And people end up, not being taken seriously, or even if you are prescribed, sometimes doctors don't follow up as they're supposed to, because once again, that's part of the neglect of the healthcare. We don't go and we don't seek, then, we don't get the help that we need. So we need to be really full on, make sure that we are doing everything we can in our power and showing our children. And so it passes on to, the different generation, that it's okay to speak out. You're not being loud. You're not being difficult. It's part of advocating for yourself so you can thrive as a person. So, yeah.
Yeah, absolutely. And I think I like what you said, Juliet, in terms of it being like a domino effect. So, if your emotional or your spiritual well-being is not in the best health, it can affect the physical, and vice versa, right? So they're all, as you said, they're all interconnected, and it's all really, really important to be mindful and to tune into that. And as you mentioned as well, is the fact that, you know, I think we know our bodies better than anybody else.
That's right.
So really tuning in, and if you get that gut feeling that, you know, if a practitioner is, you know, suggesting or making a recommendation to you for a specific medication or what have you, and it doesn't sit right with you, you know, that it's, as you said, it's okay to question it and to maybe seek um, an additional opinion as well.
Yeah.
And Althea, did you have something that you wanted to add?
Yeah, I just wanted to pick up on something that Juliet said there in terms of being passive, right? Unfortunately, Black women and people, we don't have the privilege of being passive in the healthcare system. You really do have to be an active participant. You have to ask questions. You have to get that second opinion. You have to do your own research before you go in so that you can, you know, also give the doctor or healthcare provider the different list of things that you think this might be, because we're not always getting all of that information, all of those options right off the jump like other folks are. So that's a very important point. Don't be passive. Like that's crucial to our health.
Absolutely. And just to add to what both of you just said, and I wanted to get both of your perspectives on this. As a Black person walking into a medical office, do you both feel that there is like a preconceived notion when medical practitioners, you know, when they receive a client and, you know, they can see, okay, this is a Black individual, and they sort of create their own preconceived notions of, you know, what may be wrong with the person or what challenges they may be facing. Do you both feel that that is relevant?
Definitely. I think in terms of, and it goes with all aspects of health, but I think in terms of mental health, that happens quite a bit. You know, you go to a practitioner of it, and then this is what I always tell, and like I said, like we're advocate for our community, and we're teaching the new, being mentor for the new healthcare workers coming in. You cannot go, even though we all have our own, you know, like you can have your own assumption to a certain degree, but when a person comes in front of you, you have to treat that person. You're not treating the color of their skin, and you're not treating the assumptions that surrounding them. Because sometimes I find in healthcare, especially mental health, Black women goes in, and because the way they may express themselves, they're just being slapped with labels of diagnosis that might not be, right? I don't think the time is taken to actually get to know the person. So it's just like, oh, well, I have A, B, and C symptoms. And then, okay, well, then you must have this. And then people are dismissed. And that is not okay. And this happens, like I'm sure in midwifery, it happens a lot. I deal with a lot of newcomers, like people that migrate here and then they become pregnant. They don't have the status to, you know, go into the healthcare system like a Canadian would do. So, you know, we're being very creative as to referring them to different midwifery to get the support they need, to reduce the cost a little bit, right? And I feel that when people are going through it, because there's language barrier, because there's the you know, the notion that I'm here, I might not have all my documents, that fear is there. And so when people go to see these practitioners, it's just whatever they say goes. And people are being treated really badly. I've had experience where people have lost their babies because they are, you know, they're presenting symptoms to them and they're saying, oh, like being dismissed. And that is not okay, right? And I feel like, especially when there's language barrier, people are really dismissed. It's like, you know, the communication, and that we have interpreter system that's there that they can utilize, but nobody wants to spend the extra little time. So the most important thing is, like we're saying, just advocate for yourself. If something is not right and you feel it's not right, you know, follow up. There are community leaders, there's different associations, different communities that you can connect with that can help you, maybe even arrange in terms of interpretation, getting someone to go with you, and just the advocacy there, because so many people get dismissed. They go to the emerge, they're, you know, dismissed, and they're being labeled, they're being on medication that's not right for them. And because everything you take has an effect, mental, physical, it happens, right? So if we're going to take something to manage whatever we've been diagnosed, it has to be something that's impacting our life in a positive way. right? Not just taking it because somebody slapped it on us. And I feel that that question, it happens a lot where we are dismissed, not looked at the same way. And it's like, and even the treatment plan is not the same. The support system is not there. The referral, the resources is not, the connection is not there. So we have to be, unfortunately, our own advocate, and us in the healthcare system have to really be in a community helping people learn what they need to know, learn the lingo, how to connect with different resources to help us. Yeah.
Yeah, I definitely agree. And you're right, like racism is a part of our healthcare system. And so there's discrimination, there's implicit bias, there's systemic issues that are all unfortunately working against Black people and their health. And so it's very important to be aware of that and find different ways to be able to address it. So it's significant, and it's something that our community really needs to be aware of.
Yeah, absolutely. So there's a question here in the chat. This question is for Althea. Navigating our healthcare system is a bit challenging, especially for women of color. How can we access midwifery care considering that not all hospitals and community health centers have a midwife? That's a good question.
Yeah, and so midwifery care, it's as far as regulated health professions go, it is relatively new. And so midwives are a smaller group. There's a little over 1,000 midwives in the province. And so yes, it is difficult to get a midwife. It's not the same access that you have. So one thing is education, is just knowing that midwives exist and that they're an option during your pregnancy. And then going to the right places for the resources. And so the best place to go would be to the Ontario Midwives, the Association of Ontario Midwives webpage, where there's a Find a Midwife button there, and you click it and you put in your address, and that tells you all of the midwives that service your area, because midwives work within geographic areas because we do things like home visits and home births. There's a certain geographical area that every clinic is associated with. And so the first thing is to really just find out which midwives service your area and apply to all of them. This is what I tell people: apply to all of the clinics. They all have online intake forms, and then they'll get back to you. And once you have a spot in care, then you tell the other ones that you don't need the space. But midwifery spots fill up very quickly because we work in a very specific way. So it's a little bit different than obstetricians, who can take as many clients as they come to them because they don't have to be at all the births. They don't do home visits. Like it's a different course of care. Whereas with midwives, we take a set amount of people because we do have that continuity of care. Like we are likely going to be at the birth of all of our clients, and we want to arrange our care such that we can be there. And so we take a limited number of people, so we do fill up quickly. So if people want a midwife, it's important that they sign up early. So usually midwives are like, as soon as you find out you're pregnant, you don't need a referral, you don't need to see a doctor, you just go and you fill out the intake form. Because that's another thing that breaks my heart, is when people come, they say, oh, I just found out about midwifery care, and they're 4 or 5, 6 months pregnant. Quite frankly, even by the time you're like 2 months pregnant, it might be too late to get a midwife because they get filled up. So whoever asked that question, you're right. There is a definite issue with access to midwifery care, but I want our community to be armed with the information that can help them get into care, which is do it early. Go to the website, find out which midwives, apply to all of them, and do it as early as you can and try and get yourself a spot in care.
Yeah. Especially, I just want to add, especially if you are someone that's here and you don't have all your, documents and what have you, it's very, very, very important to access the midwifery early, because your options are very limited. Whereas, like Canadians have they can choose an obstetrician and go anywhere if they really choose. If they don't get the midwifery care, there are other options. But whereas other people the immigrants that are here that don't have the status, all of that, you don't have that option. And it's very, in terms of pricing, because we have to be, mindful that it's very expensive to live here and to give birth and all of that, right? Especially if you're not Canadian, the price is very different. So midwifery is very reasonable. And sometimes what I've been doing in my advocacy is like working with different midwives to try to get clients some perks in terms of reducing some of the costs, coming up with payment plans. So those options are there, but like I said, it has to be early. You can't wait till, I know sometimes people call me and they're like, oh, I just landed, I'm 8 months pregnant. Oh my God, right? So you have to go in very early so we can connect you with all the resources, and it will help you in terms of payment plan and all of that too, because to give birth at the hospital is quite a bit. And then if you do go early and there's, God forbid, any kind of complications that's found early, then the care is planned so you're healthy and the baby's healthy, right? And all of that could be arranged, but you have to do it as early as you can. And like this, she said, they work in catchment, so you have to apply to whichever catchment that you live in so you can get the services. But I find I work with the midwives a lot throughout Ontario. It just makes my heart smile because of the care that clients get, and it's night and day, right? Because when people are going through their own, I call their own issues with all the layers of immigration and all these things, the last thing people are thinking about is unfortunately their health, really. So when you get someone that really sits down with them and walks them through, and they go do the home visit, and just removing that anxiety that's associated with all of that, it's priceless in terms of improving their mental health, improving their pregnancy health, and then giving birth to a healthy baby, and then they can thrive. So please, if you're interested in midwifery care, do it early. As you're planning to get pregnant and you're taking your vitamins, start looking into the midwifery. So as soon as you're pregnant, do that, that connection, and it helps. It really is night and day. So I recommend people look into that. Yeah.
For sure. Wow. You both are dropping like just really important information. There's a comment and a question in the chat. So there's a comment. And it reads, "Thank you for this excellent discussion. Racism, discrimination, and prejudice do affect the healthcare that is delivered to Black women in our system." And there's a question for both of you. How would you recommend navigating this for women who are going through IVF? At what point should they seek midwifery care once they are at the embryo transfer stage?
Yeah, that's a good question. So usually what you need to confirm the pregnancy before having midwifery care. And it's a good discussion to have with your fertility provider. So they should have kind of all the information as to when the pregnancy is confirmed and when to move on to the next step. Oftentimes, if they're referring to an obstetrician, they might wait a little bit longer, but just have that conversation with them and say, I'm really interested in midwifery care. Can you please let me know when it's confirmed? When is the time that I move to that next step and I contact the midwives? So
Yeah.
as soon as a pregnancy is confirmed, but speak to your healthcare provider who's managing that process.
Soon as possible. Yes.
Yes, absolutely. Okay, so I have another question. So I will throw this question to Juliet. So Juliet, what culturally affirming self-care practices can Black women incorporate into their daily routines to nurture their physical, emotional, and spiritual health?
Very good question. And like everything that we've been talking about, our body is a machine that's connected, right? Our brain is very powerful. Everything that affects here affects the rest of the body. So anything that you're doing that could improve your immune system and all of that will help improve your mental health and physical health. So for example, if somebody's if you're someone that you find yourself very stressed all the time, like you're going through, life happens. We go through periods where we're very stressed and things are happening. Once again, tune into yourself, because nobody knows you better than yourself. So if you're, let's say, having sleep issues, right? And sometimes the thing is, sometimes people don't really cannot pinpoint, oh, this is what's stressing me. Because in my practice, people come and say, oh, Julia, but I'm fine. I don't have any stress. And then as we're conversing and talking, they realize, oh, so this is what's going on. This is what's happening. Because sometimes we're too busy to even be mindful of what's happening to our body. So use your body as a way of talking to you. So if your sleep is impacted where, you're not being able to sleep, not because you don't have the time to sleep, but you do go to sleep, but you're not getting the restful sleep that you need, that could be an underlying issue that you need to tune in. If you're waking up, you're sleeping enough, but you're waking up feeling extremely tired, there could be an underlying issue. If you're all of a sudden find yourself eating more than you normally do or not eating at all, right? Because when people are going through their own issues, some people will eat a lot more and some people don't eat. So compare everything that's happening to you now to what you're considered your normal is, because all our normals are not the same, right? So if you find that these things are happening, then kind of tune in to see what's happening. If it's sleep issues, try, sometimes, I know I'm bad at it too, like the sleep hygiene is not there because we're on our phones, we're doing a million things, we're doing that, we're distracted. So we're not being able to get the sleep. So sometimes it's not like there's anything mentally wrong, it's just we're being distracted. So if you're doing all the sleep hygiene, let's say you're turning off your phone at a certain time, you're going to bed on time, you have scheduled bedtime where no matter what, you're laying down trying to sleep, you do all those things and you're still having issues, then I would say check in with your any kind of clinician that you have to say that this is what's happening. And then you can go from there. It could be underlying issue like sleep apnea, where you're sleeping, your brain is not getting enough oxygen. So you're waking up because it's a survival mode. Your body's waking you up so you don't die from your sleep, right? So that could be an underlying issue. It could be a mental health issue where you, like, maybe you're going through an early stage depression. So now you're not getting enough sleep, or you're sleeping too much, but it's not restful because of what's happening. So, and our body works with all kinds of hormones. So when these things is happening, whether we realize it or not, our body goes in the fight or flight mode, period, whether we realize it or not. And what happens is that when we're under stress, and this is happening when you're not sleeping, your body thinks of as stress. If you have physical stress, that's stress. So anything that it's against the norm of your body will internalize that as stress. And when that happens, the hormones that are being released that will cause your blood sugar to go up, it will cause your blood pressure to go up. Everything starts going in the negative direction. People start to get prediabetes. If you have family predisposition, it can set into diabetes. High blood pressure happen, heart health is being impacted, your kidney health. So everything is connected. It becomes like a trickle effect. So it could be a sleep issue that can lead to a bigger diagnosis that you have to now try to navigate. So everything that you're doing, let it be purposeful and be mindful. Try to get good sleep. Make sure you're exercising, because when we're exercising, our body's releasing the feel-good hormones. That is the anti-stress hormone. So it fights those stress hormones. So it helps you, blood pressure goes down, cholesterol is not forming, and you're able to take care of yourself. If you even have diabetes, blood pressure improves, right? So the exercise does the physical and the mental work for us. So doing that is very important. So if that's something that you're not doing, right, you can incorporate exercise into your routine. Doesn't mean you have to join the gym or become a bodybuilder. Anything that you can do 20 minutes or more in a day is good enough to improve your health, right? So making sure we're sleeping, making sure we're taking care of like exercising, and nutrition is also important, right? Because we all know when you're very stressed, the last thing you're thinking about is, let me have my salad and whatever. Okay, you just want to eat. And usually we eat a lot and we eat very fast, right? And when we're doing that, those practices doesn't help us. It takes our brain about 20 minutes to realize we're full. So when we're going through all these challenges, we're sitting there just shopping, like eating. By the time you realize you're full, you have eaten probably 3 times the amount that you're supposed to be eating, right? That leads to weight gain. When the weight comes on, metabolic syndrome comes in. That's where blood pressure goes up, sugar start going up, cholesterol start going up, and then it makes us sick. So everything that we're doing, we have to try our best to be purposeful. So not saying that we don't all eat certain times or, just follow the 80-20 rule. 80% of the time, try your best to exercise, eat healthy, control your stress the best way that you can. Spiritually, whatever you do, if you're Christian, you're Muslim, whatever spiritual group that you belong to, just do whatever helps you feel sane and feel that you're in charge of your health. Doing all those things help us. And then as Black women, we have to also say no, because I know myself, we just, we have the list of things and it just keeps going, especially us in the community, doing a lot of community advocacy and where everybody comes to you for you to help. But you can't work from an empty space. And, compassion fatigue is a real thing. I have experienced it. You want to help, you want to be there. You have been traumatized, so you know how it feels like for people to go through what they're going through. So you want to be there and you want to help. But in doing that, we still have to take care of ourselves, right? Whatever we're pouring into people, we have to also pour into ourselves so we can continue to thrive. So just whatever you're doing, just be mindful that, I'm getting the exercise. If the exercise stops for whatever reason, just go back. We're human, life happens, things happen. Go back to exercising. Try to, if you're not eating the balanced meal and you're not getting all your vitamins, you can supplement, right? So just work with your healthcare, like take care of yourself, and then whatever the best way you can, and then whatever cannot be done through that self-help, that's when you seek other support from your clinicians and get advice and all of that, right? So we have to be mindful. Saying no is not a bad thing. Doesn't mean I had to learn that because you just say yes to everything. Your list becomes this big and now you have so much to do. it burns you mentally, physically, right? So we have to be able to do that. And we do, and I think we're very resilient as Black women. And I like that about ourselves, but being resilient doesn't mean we have to say yes to everything. And being resilient doesn't mean that when we need the help, we can't get the help. That's part of being resilient, getting the help that you need, going after what you think can help you thrive, your family thrive. That's important. Because if not, and we get to the compassion fatigue, then all the beautiful energy that we want to put out there just doesn't happen, right? We're not able to work from a good place. So just do your best to incorporate healthy habits, right? Because that's, at the end of the day, there's no medication that will fix anything. Like I'm a bariatric educator, I'm helping people lose weight, and everybody tell me, just give me this medication. And I'm sure you all know that one that everybody wants. Give me this and also, no, it has to be the lifestyle management. You learn the right way of doing things, and then the other things can come in and help, right? Because we're living with ourselves for the rest of our lives. There's no quick fix, right? So just do your best to incorporate as much healthy habits as you can into your routine.
Yeah, for sure. Thank you so much, Juliet. I really like what you said about doing a check-in with yourself to see where you're at in terms of how you're feeling, like you mentioned about the sleep, which I think is really important, especially I think in this day and age that we're in, because life is so busy and we always have about 1,000 things to do on our to-do list. So it's so easy to, get into a routine where you're getting less sleep, or you're not getting good quality sleep, and it just kind of becomes a norm. And then you don't really realize that that's your body's way of trying to communicate to you that, perhaps your stress level is too high in that instance, or maybe there's, as you mentioned, there's too much on your plate. And maybe you do need to cut back on that. So yeah, all of that I think is wonderful advice for our audience. So I do have a few. There's some more questions that are coming into the chat. So there's another question here, and this question is: do midwives work with naturopaths?
So definitely midwives are really collaborative. And like I was saying earlier, it's about putting together that healthcare team, right? It's not just about that one provider. It's about addressing the whole person. So we definitely love when our clients already have a naturopath. Sometimes that's something that we'll recommend to them. If there are certain issues going on that it seems like, maybe they're having recurrent yeast infections or something like that. And okay, so you've tried, different antibiotics and it's still not working. Well, a naturopath is a great provider to check in with next to really address the whole person. And let's think of some other things and ways that we can treat this versus just medication. So definitely love to collaborate with naturopaths and to recommend them to our clients. So yes.
For sure. That's very good to know. I didn't know that. So I'm also learning this afternoon. So this is great. So we have, there's another comment in the chat. So yes, need lifestyle management for longevity also makes one a role model. So thank you for that, Sylvia. And then there's another question for Juliet. Have there been any studies done in Ontario on mental health, specifically the impact on Black women?
So there have been case studies, so not big studies where, whatever study we get, right? But there haven't been huge number, but we do know that doing all the different analysis, that in terms of mental health is underreported in terms of Black people in general, not just Black women, just Black people in general. Because most people, when they're going through their own issue, the first problem is that most people don't even know this is what's happening to them. That's first step. So they could be having symptoms and all these things, but they don't know where to turn, or they don't even know it's part of some kind of mental issue that they're having, right? So it gets underreported. And then those that go to seek treatment, sometimes because of how the treatment is, like how the routine is, most people will stop taking medication or what have you. And then we deal with all the different stigma of it, right? I know in the just in Black in general, but in the African population, I know that's a huge deal because nobody wants to tell the next person that I'm taking this because it's a taboo. Like I'm not crazy. Why am I taking medication? But that's not. So we're trying to change the narratives around mental health, and that if just like I always use this analogy to explain to people, if you have diabetes and you come and see me and I'm working with you, the reason why you have diabetes is because your body is not able to make insulin. Insulin is a hormone that our body needs to be able to utilize sugar so we can live. If somebody's diagnosed with anxiety or depression or other mental illness, there are hormonal imbalances that's happening. So we have to treat it the same way. So people feel comfortable. I can tell you that, you know what, I have diabetes easier than me coming to tell you that, you know, I'm suffering from seasonal affective disorder or I'm suffering from depression because of the stigma that's associated with it or what people think. So I think because of that, even if we're trying to do different studies and case studies, people don't readily join because they don't want to be part of that statistics, unfortunately, right? But we do know that in terms of comparing health with, you know, Black community against other communities, that, you know, mental health is there, the symptoms are there, people are suffering, the suicide rate, usually, unfortunately, when it ends in that kind of, then it becomes part of the statistics because that's when we find out, no, the person was going through A, B, C, D, and it led to this. But while they're going through the symptoms and they're suffering in silence, all of that doesn't really, they don't report it because of the stigma, right? Because sometimes when you go to the clinician, you don't get the support that you need. So it turns people off, they don't go. And then sometimes some of the medication, people, first of all, don't want to take the medication because they think if I'm taking medication for any kind of any psychotic medication, that means I'm crazy, right? So that stigma is there. And then there's lots of side effects that comes with these medication. And sometimes people are just prescribed and they're not explained to what's going to happen to them. So as soon as they see one thing, they just stops, right? Or some of them will take it, symptoms go away and they feel good and they just stop, right? So the proper education around it is not there. So putting it out there, if you're on any medication for, you know, managing anxiety, depression, schizophrenia, whatever mental issue that you have that you're taking medication for, if you feel better, the reason why you're feeling better is because you're probably doing all the good things that you were told to do, which is take care of yourself, exercise, eat healthy, and plus because you're taking the medication. The minute you remove one of those good things that you're doing, symptoms will come back. And sometimes it comes back with vengeance because the medication has its own withdrawal effect and you already are going through some symptoms. So it will just make everything worse. So if you are taking medication, you're feeling better, you're feeling great, you go back to the prescribing clinician. This is how I'm feeling now. I feel less anxious. I feel less depressed. I feel great. Then we will work with you to reduce the medication slowly to a point where you feel good enough. And because it's slowly been taken out of your system, the withdrawal symptoms is very manageable. But if you don't and you just stop, sometimes it can bring a relapse that's even very difficult. So we have to change the narrative about mental health. I mean, the stigma is there, unfortunately. I mean, I've even had like some family member tell me, and I'm from Ghana, so she's saying this in my dialect, like, why would you take medication because you're nervous, right? They're referring to anxiety. So being nervous and anxiety diagnosis are two complete different things, but it's just sometimes the way the language goes and the way people think so if somebody's have anxiety and they're taking medication, they hear somebody say that, do you think they would disclose? Of course not. They wouldn't because, right? So we have to be very mindful how we communicate with each other. Our kids are growing up. Suicide rate, unfortunately, is very high among the Black community, the younger population. So we need to be mindful, check in with our younger population and change the narrative. So if something is happening, at least they can confide in their parents, like somebody that they trust, and then we can start the process. So yes, lots of work to be done. We have our work cut out for us, but you know, if we're all speaking the same and singing the same song, I think eventually we'll get there.
For sure.
Mhm.
Thank you so much, Julia. And I think this platform that we're on this afternoon with 100 ABC, the Fireside Chat, I think is really a great way a great place to start in terms of trying to destigmatize the conversation by the dialogue that we're engaging in this afternoon. You know, hopefully those that are tuned in can take away some tips and some strategies to really to open up the conversation, to make it so that it's not there's not a stigma attached to it. You know, I think it's important, because if you are indeed, if you are struggling out there, the importance of reaching out for support. Yeah, there's nothing wrong with, as you said, there's nothing wrong with asking for help. I think all of us at some point in our lifetime will, you know, face some type of challenge or struggle where we are going to need some additional support, and that's okay. It's okay to ask for help and support. So I want to turn my next question to Althea. So Althea, you've been a strong advocate for racially concordant care in midwifery. Can you share why this is so critical for Black women's health outcomes, and what steps need to be taken to expand access to culturally responsive care?
Yeah, great. Yeah, racially concordant care really means receiving care from somebody with the same race or ethnicity as the patient, right? So it's important to understand what that means. And it's been shown the research shows that it improves outcomes. There's increased trust, communication, and all those things that definitely lead to improved health outcomes. So it's very, very important. And actually, I want to tie this back to something that Juliet was just talking about, and that plays into the last question, is in terms of race-based data. We don't have, when they said, oh, is there a study involving Black folks? No, there's not a lot of race-based data here in Canada, right? So if you notice in the United States, there's a Black maternal death rate. There's all these things where we don't have that specifically in Canada, which is a big issue, because if you can't prove it, you can't quantify the need for solutions, which means that programs like mine and others don't get funding because there's no problem, right? So it's really, really important, and to support racially concordant care is we need to have the data that shows, one, that racially concordant care improves outcomes. So that's one. Two, we also just need to make sure that as Black folks, we are participating in these research studies so that we can get that data, and making sure that those that are conducting the research are accountable to community, and making sure that we get the results of this data so that we can use it to support what we already know to be happening, and to be able to support funding to get these programs going. But to kind of go back to your question, yeah, it's very important to have racially concordant care and to support that, because people do, and I see it all the time in my work in our clinic, where we really are Black focused and Black midwives providing care to Black clients. There's that trust, there's that relaxation. People kind of come in and they can just kind of breathe out and relax and let their guard down and have that open communication and really have that relationship with their healthcare provider that does lead to better outcomes. So I see it in action every day. So I'm, of course, a very strong supporter of it. And the way that we get this to happen more is, one, we need to support our Black practitioners. We need to recruit and retain them. So it's not just about, getting them into the program. Well, one, they need to finish, and they need to stay in the profession. And it's important for all providers to have training on providing care to the Black community specifically. I think that's a big piece that's missing because we don't collect the data. We don't see that there's an issue. So all these things sort of fall through the cracks. And so I really do think that racially concordant care is part of the solution. Am I saying that somebody of a different race can't provide good care to the Black community? Not at all. They can, but the Black community needs to be involved in that care. There needs to be somebody at those tables that are making those decisions. Especially if we're talking about Black health, there needs to be Black people at the table and contributing to that knowledge base and contributing to the decisions and what's being made there. So yeah, this is something very near and dear to my heart, something that I want to see increase. Part of why I do say yes, and I do take on additional things of like mentoring our midwifery students, because I want to see more Black midwives, because I know they're going to make a difference in our community and beyond. So yeah, so important. And I hope that we do continue to, contribute to that research. We do continue to motivate our community to get into the healthcare field, and then support them to be able to stay there and provide good care to our community as well as others.
I just want to add, that was excellent. I just want to add that, in my perfect, when people come to your office and you can explain to them in terms of, because people get diagnosed with all kinds of conditions, they throw them out there, go see so and so. When people come and they realize that, you know what, you understand the type of food they eat, you understand the cultural background, you understand some of these challenges that they're facing, it's night and day in terms of people adhering to treatment. Because I've had clients come in where, in terms of their diabetes management, it's just very scary. Their sugars are through the roof, just blood pressures, it's like they're a stroke and a heart attack waiting to happen. Because they've seen clinicians, not that I'm not blaming that, because there's no connection there. If you can't make people understand why they're doing certain things, they're not going to listen to you, no matter how important that you might think it is. So if I'm teaching someone about healthy eating and like how to plan your meal and all these things, and the person, for example, go to see somebody that doesn't understand their cultural aspect, the food they eat, and how, in terms of portion control, how to go from there, it's like you're talking to a wall. It just, people can connect. So it is very important what you're saying, that we do get clinicians that are from us, taking care of us, because it makes a difference to be on the healthcare team. It doesn't have to be that everybody, at least but one person has to be there to do the connection, because sometimes the doctor's like, oh, I don't know, Juliet, I give up. I don't know. I've prescribed A, B, C, D, E, and nothing is happening. That's because the folks are not taking it. If the trust is not there, they can't connect. You're telling my African person, like somebody from Ghana, like for example, my dad comes and see you and go, well, now, Mr. Poku, you have to eat this and this and this. He's gonna look at you, in his mind, he's laughing because it's not happening. But then if they see somebody that understands their culture, they explain to them the same food that you're eating, you can make it healthier. So we're not changing people's diet, because you cannot tell me to stop eating my Ghanaian food. Not gonna happen. We probably won't get along. It just won't happen, right? So we have to use what people are, being culturally sensitive to what people are going through and meeting them halfway. It's night and day. People change their diet. They're exercising now. They're taking their medication because they understand, they're connecting the dots, why all this is being put in place, right? But if you go to see someone that tells you, well, eat a half a sandwich and do it and add this salad, and that's not what the person is used to, it's not going to happen, right? So this is spot on in terms of, being mentors for the children coming up into the health field and making them stay. So we have to mentor them, give them all the appropriate tools so they'll be able to continue what we're doing, because really it makes a huge difference in terms of especially chronic illness management, because this is people's lives and this is what they're living with for the rest of their lives, right? So it has to be something they can incorporate into their routine to help them survive and thrive. So I'm with you on that one. We need to, and please, if there's studies and you belong to a church or whatever group, organization, and they say, oh, this person is doing a study about whatever, just get the information, see if it's something that you can contribute and help, because these information help us. Like if you said, to get funding and all the other stuff, because if we can't prove it, we know it's happening. I mean, there's no two ways, but we have to, everything requires data. So we need that. So any way you can contribute, please do, because it helps all of us. Right.
Yeah, no, absolutely. I think both of you made some really, really excellent points in terms of, the individuals that you're working with, being able to relate to them on a cultural level, I think is extremely important. And even going back to as a child, going back to, your experience going to school and the type of teachers that are teaching you. So it really starts from from when you're young. There have been many studies that have proven that children that have, or Black children that have a Black teacher, at least one Black teacher in the span of their lifetime, can make a world of difference in terms of their own personal outcomes, and also just how they feel about themselves, how they feel that other people view them, and there's a whole slew of other benefits. I do want to address, there is a question. I see Sylvia has her hand raised. I'm not sure, Sylvia, are you able to unmute, Sylvia? If you'd like to unmute, we'd love to hear your question. Or if you're unable to unmute, you can always just you can pop your question in the chat. If I hope you didn't forget your question. All right, so we'll give Sylvia a moment to see if she can unmute or add her question to the chat. But yeah, as we're sort of winding down to our session this afternoon, do you both have any final thoughts, words that you'd like to share? How can those that are tuned in this afternoon, how can they get in contact with you, or how can they follow you? I'll pass it over to Althea and then Juliet.
Yeah, just to add really the main points of be your own advocate. Don't be passive in our healthcare system. Like it's important because unfortunately it's not really made for us. We're working within a system that's not made for us. So we do have to take some additional steps. And in terms of how you can find me, Ancestral Hands Midwives on all social media. So on Instagram and YouTube, so at Ancestral Hands Midwives, and you can also just Google us if you're looking for Black midwives. That's where you'll find Ancestral Hands Midwives. We have a clinic located in Scarborough, so yeah, please reach out.
I'll be reaching out to you. So myself, because I do work with a lot of and I say all the pregnant women call when they hear, especially the ones anyways. So I'll be reaching out to you. So for me, like my company is Living a Balanced Life Incorporated. So if you Google that, you'll find me as well. Instagram, Facebook, LinkedIn. I do have a YouTube channel. So it's called Living a Balanced Life with Julie O. So it's Julie with 2 O's at the end. So even if you just put Julie and the 2 O's at the end, it will pull all my videos. I have videos on all kinds of chronic illness management, mental health, all of that's out there. For people to share and help them improve their health. But like I said, be your own advocate. We have to, us in the healthcare, has to also advocate for our clients. If someone comes to you and they need resources, let's be as supportive as we can. Let's not be dismissive, because I've seen that happen too. Sometimes when people get into certain position, they become something else. Please just continue to be our authentic self to help our community, for our community to thrive, because people ask questions because they don't know. And for everybody out there, please ask questions, because there are resources that you might be entitled to that you might not know. So for example, people that have diabetes and all these chronic illness that they're dealing with, there's special diet allowances, other things that are out there that you might not readily know, but connect with someone that can help you navigate through the system, because it could be very challenging, especially if you end up in a hospital system and now you're coming back into the community. It could be very frightening because you don't know where to turn. Any community agency, community CHCs out there, if you connect with them, they have different services for you. They have doctors that can help you. They have nurses, they have diabetes educators, they have all kinds of social workers, everybody that's there as a team to help you, because we do need that team. And because we're not treating just a diagnosis, we're treating people. Right. So if you need the resources, please reach out in any way that we can. We'll try our best to help and support so we can all thrive.
All right. Well, thank you both, Althea and Juliet. Thank you so much for being here this afternoon and for lending all of your advice and your wealth of knowledge in both of your respective professions. We really, really do appreciate it. And yeah, thank you all for watching as well. I hope you all enjoyed this afternoon's session. And we hope that you will join us again next week for another session of the 100 Fireside Chat. Thank you.
Take care, everyone.
Look how far you have come on your own, but never